We are back on the record at 11:37 a.m.
All right.
Yes, I'm
You want some coffee too?
No.
Did you speak with anyone over the break? Did you speak with anyone over the break?
My daughters out
Okay.
there, yeah.
Did you speak with them about this case?
No.
Okay. Anyone else other than your lawyer?
No.
Okay. Do you agree that patient safety comes first?
Yes.
True. And everything else comes second?
Right.
You agree it's never all right to needlessly endanger a patient? True.
True.
And you agree it's never all right to lie to a patient? True.
True.
It's imperative that you be honest with patients? True.
True.
At all times?
Yeah.
Have you ever lied to a patient?
No.
Okay. We were talking earlier about biophysical profile,
Yes.
and we call that the BPP, right?
Right.
And that's scored on a 0 to 10,
Right.
right? Or 0 to 8, depending on,
Well, 0 to 10, really, technically.
right. 0 to 10. And do you agree that on May 21st, 2012, Angel Mylan's biophysical profile was a 6? True?
That's what we were told.
Yes, ma'am.
Yes.
And her gestational age was 36 weeks, 6 days. True?
Right. True.
And according to the literature, if you have a biophysical profile of 6 out of 10 and gestational age greater than 36 weeks, the thing to do is induce labor. True?
Check to the form.
No.
Okay.
It's equivocal, so you can repeat it. And the component that I mentioned earlier in the case was there was a biophysical done in an office where the NST cannot be optimized because you can't replenish the patient's intravascular volume, which we've seen to improve the NST tremendously.
With
So you
fluids.
would, exactly, so that would then be 8 out of 10. So then you would have cut someone or induced labor unnecessarily.
Okay. You agree that, well, you cared for Angel Mylan at Southfield Medical Center in April of 2012 as well. True?
Did I care for her? So I guess if you see it in the records, I can't recall.
Yes, ma'am.
Yeah.
Her biophysical profile the month before the baby's May 21 demise, her biophysical profile was 4 out of 10. True?
No, that was actually on Dr. Braswell's admission, and it did improve.
Yes, ma'am.
So the 4 out of 10 would have not been a factor if she got an 8 out of 8 after that. I think they repeated it.
Yes, ma'am.
I remember that vaguely.
Right.
So then it wasn't a 4, it was an 8 out of 10. 8 out of 8.
But if you have a patient that has a 4 out of 10 and gestational age greater than 32 weeks, the indication there would be to induce labor as well. True?
Yeah, but it wasn't 4 out of 10. It was 4 out of 8, and then with the NST, if I remember correctly, because that was on Dr. Braswell's admission,
Right.
that would have been 6 out of 10, because I think she stated her NST was reactive.
We'll look at the record. It's not the way I recall it, but I think it
That's
was.
the way I remember it, because I remember, yes, I think I remember it that way.
It was 4 out of 10.
It was 4
and then
out of
8
8,
out of 10, right?
and then when she had the NST, or when she had on a monitor prolonged with some IV fluids, it was like 6 out of, the NST was reactive.
Okay.
So that's why they took time to repeat it, because that is within standard of care. If anything is equivocal, you don't act on it, because it's equivocal. It's not giving you an answer, yay or nay. So you repeat it. And when they repeated it, from what I saw in the records, it was 8 out of 10. So that's legitimate.
By legitimate, you mean?
That's a fetal assessment that's reassuring.
Okay. Would it? You knew in May, on May 21st and May 22nd of 2012, that Angel Mylan had a biophysical profile the previous month of 4 out of 10. True?
No, it wasn't 4 out of 10. So once again we're getting that wrong. It was not 4 out of 10.
It was 4 out of 8.
Why don't you show it?
Complete assessment was like 6 out of 10, I believe, what Dr. Braswell had put.
So it's your testimony. She never had a 4 out of 8 in April 2012.
4 out of 8 now. You switched it from 4 out of 10 to 4 out of 8.
Well, no, I'm just, you said it was 4 out of 8 instead of 4 out of 10, and,
Yeah.
I mean,
That
that's,
just alluded, I mean, that just excluded the NST, which they get upstairs in the, you know, the labor and delivery suite. And I
Okay.
thought, so that, I think she came upstairs with a 4 out of 8, and when they put her on the monitor, she got a reactive. That's what she documented, I believe. So,
Right.
so that means 6 out of 10. So then she did follow the standard of care and repeat it, and before she let her go home, it was 8 out of 10.
right, okay. So it went from 4 out of 8 to 8 out of 10, true?
It went from 6 out of 10 to get the complete, because you know 8 and 10 are there's
Okay.
apples and oranges. So let's get the full denominator there.
Here's her progress.
So
Here's her
6
progress
out of 10
note.
to 8 out of 10.
Okay,
Yeah, 8 out of 8. Okay. Yeah.
That's her progress.
Oh yeah. I don't know. This AM 8 out of 8. Yeah. What was the one before? I don't see the one before, but I know she had it in her notes. Yeah. It's clear. I mean, there's no confusion. It's on the documented radiology report, 4 out of 8. So I think there was just a mistake
For the-
where you said
for the-
4 out of 10.
yeah, just make
4
a
out of
note
8.
about what document, what, for the record, you're looking at, that's okay.
The South Fulton records from that admission.
309, right? Is that what that says?
Yes.
Okay.
And
For
you
the
s-
record, I'm sorry, go ahead.
No, go ahead.
You're looking at South Fulton Medical Center 0309, which is, let's see, the 4/27/2012, or the month before May 2012, admission for Angel Mullen, and demonstrated cardiac activity with a heart rate of 158 beats per minute, biophysical profile, fetal breathing, movements 2, gross body movements 0, fetal tone 0, amniotic fluid volume 2. So that's a 4 out of 8, true?
True.
Okay. And,
This is not the complete biophysical. That's what
okay,
I'm looking
show me the complete biophysical.
Well, the complete, like I just explained to you, in any hospital, they don't do the non-stress test in the radiology department.
Okay,
That's done on labor and delivery.
right.
So this is a radiology report.
Yes,
with
ma'am.
a radiology assessment. So once the patient got up to labor and delivery, she had the 5th component of the complete biophysical profile, which was the non-stress test.
Okay,
And without seeing any additional information, just from going off of what I recollect, because you know we get signed out on our patients. I remember Dr. Braswell saying that it was 6 out of 10, so she repeated it, which is totally appropriate, meaning the non-stress test had to be reactive, because you don't get 1, you get 0, or you get 2.
right.
So 6 out of 10
Okay,
was where we were, and then before she went home, she would have, you know, implemented a delivery or intervened somehow if the biophysical or reassessment of the fetus did not improve, and it improved. She said she sent her home with 8 out of 10.
okay. Turn to 282.
Is that in that chart?
Yeah, here. Is it?
I don't know.
I've got it.
This is the chart from the admission of
I'll get you
4/27.
one.
What, these aren't chronological, Jim, they're organized by, what is 287?
So I got it, we got it. That's okay. I got it.
Oh, that one? Is that what he's saying? 0282?
He said 287. 282, I got it.
You talking about these orders? Or, no, this submission?
So history here.
Yeah, history, yeah.
Okay, do you see that up top?
This is
I need- This is
so,
I need a-
okay.
That's what
What's
I'm
your question, yeah.
What's that?
I was trying to figure out what the question was.
Let me see.
Who is
got-
this that filled this out? That's not Dr. Braswell.
Is it not?
No, that's not her writing. Must have been a midwife or somebody that filled it out. What date is that? Yeah, she didn't fill it. This isn't her writing. This is a midwife. But anyway, go. I didn't understand.
Looks like,
the
if you
question.
look here right toward the bottom, it says Dr. Braswell consult, is that right?
Oh, that's why it's not a writing, because somebody's
Right.
writing and it consulted her. Then okay.
And if you look up here at the top, do you see, and for the record again, we're at South Fulton Medical Center 0282, which is a history and physical for Angel Mullen for the April 27, 2012 visit, true?
True.
And it reads, this is a 30-year-old, what does that say, G3P0020, here because she felt no fetal movement times 2 days, true?
I see that.
Yes, ma'am.
Yes.
Denies, what is that next word?
I guess rupture membranes. I don't know
Okay.
what that is.
Denies RUC, whatever that
or
means.
regular uterine contractions. 'cause
Okay.
RUC, we don't
Denies
write that
contractions, bleeding,
spontaneous rupture membranes.
or,
I don't know what that is.
okay. You're going down, she was 33 weeks and 3 days at that time, right? Yes?
Yes. Sorry.
And if you flip on over to the next page, 283, you look over here to the right.
Okay.
Help you in this area.
Yes, I see.
Says OB/US, that's an ultrasound, right?
Yes.
BPP 4/8, true?
True.
-2, movement none, right?
Movement and tone.
What's that?
Tone.
Movement, oh, that
Slash
says tone? Okay.
Tone.
I thought that said none. So it was absent for movement and tone, right?
Yes.
Okay. And if you look on down to the bottom, it says impression, provisional diagnosis. One, I don't, can you read that? Something
Yes.
33
Admit
weeks.
to 23-hour observation. Repeat
Okay.
BPP in 24
Okay.
hours.
And then it looks like it's labeled 3, BPP 4/8, true?
Yes.
Okay.
Oh, that you're right there. Intrauterine pregnancy at 33 plus weeks. I'm sorry. I
Yes,
was
ma'am.
down at the plan.
And then what is this?
Hypertension
Okay. Or is that HIV positive?
or HIV positive.
yeah.
Yeah.
And then class, was that class?
B, diabetes mellitus.
Yeah, okay. And then I think down here, if you look on the left, repeat BPP within 24
Yeah.
hours, right? Yes?
Yes.
And that's what you were talking about. In other words, it was 4 out of 8 here. They repeated it, and before they sent her home, it was 8 out of 10, right?
Right, because
So
it
we got-
really was 6 out of 10, so that's why she repeated it.
Okay.
The 4 she wouldn't have sat on.
Okay. And you were and my point with all of this is in May of 2012, you were aware that she'd been admitted with a BPP of 4 out of 8. Let's see,
6 out of 10.
about, okay, 4 out of 8 or 6 out of 10, about 3.5 weeks earlier, right?
Yes.
Okay. You agree a biophysical profile is a prenatal ultrasound evaluation? True.
And non-stress tests.
Yes, ma'am.
Fetal heart rate monitoring too.
I'll get to that, but thank you. And of the fetal well-being involving a scoring system, true?
Right.
With the scoring being termed the Manning score, true?
Okay. Yes.
The modified biophysical profile consists of the non-stress test and amniotic fluid index only, true?
Yes.
The procedure, the biophysical profile or BPP has 5 components,
Yes.
4 ultrasound assessments and the NST or non-stress test, true?
Yes.
And the non-stress test, you call that NST, CTG, either
NST.
one. NST. I'm sorry,
The
evaluates,
CST is separate. You're saying something, that's something different.
okay, evaluates fetal heart rate in response to fetal movement, true?
Yes.
And the 5 discrete biophysical variables are fetal movement, true?
Yes.
Fetal tone,
Yes.
true? Fetal breathing, true?
Yes.
Amniotic fluid volume,
Yes.
and fetal heart rate.
Yes.
And I think you were suggesting earlier that the fetal heart rate is a component of the biophysical profile,
Right.
true? Just because you have a biophysical profile doesn't mean you ignore the fetal monitoring strips for a baby, though, true?
No, you don't ignore them.
Okay.
You have to evaluate those. That's part of the biophysical.
Non-stress test parameters are at least 2 accelerations in 20 minutes, true?
Yes.
Abnormal is anything less than that, true?
Yes.
Fetal breathing movements at least 1 episode greater than 30 seconds, right?
Yes.
or let's, and you get a 0 if they're none.
If they don't meet the criteria.
What?
If they don't meet the criteria.
Got it. Okay. And all these, if they don't meet the criteria, you get a 0.
Mm-hmm.
Fetal activity, gross body movements, at least 3 or 2 or 3 movements of the torso or limbs. True.
Right.
Fetal muscle tone, at least 1 episode of active bending and straightening of the limb or trunk. True.
Yes.
And it's okay. Interpretation of each assessment is graded either 0 or 2 points, right? And then added up to yield a number between 0 and 10.
Yes.
And a BPP of 8 or 10 is generally considered reassuring. True.
Yes.
Do you agree the presence of these biophysical variables implies absence of significant CNS, hypoxemia, acidemia at the time of testing? True?
Those are just some of the things that,
Right.
yeah, doesn't have to be those.
Okay. By comparison, a compromised fetus typically exhibits loss of accelerations of the fetal heart rate. True?
No.
Okay.
Remember, I just stated if they're dehydrated,
Yep.
if we're dehydrated, we don't function optimally.
Right.
If they're dehydrated, same thing occurs. So they won't have acceleration. Doesn't mean they're compromised neurologically or anything else that, you know.
Is it your opinion that when Angel Milan got to Southfield Medical Center on May 21st, 2012, that she was dry?
Well, I would say so, being that looking at her history of noncompliance with her antiretroviral, HIV, with her diabetes, with all noncompliance with prenatal care, basically.
Yes, ma'am. Right.
That could have caused this incident. But
Okay.
yes, I
Okay.
would say that she was noncompliant with her hydration recommendations as well.
And which made her a little bit dehydrated, right?
Absolutely.
And there's some tests you can to determine the extent of dehydration. True?
I'm unfamiliar with those. What would that be?
Well, have you ever taken a patient's pressures?
That won't tell me if they're dehydrated all
Really?
the time. No. That's
Well,
just one. That's just one factor among many.
Right.
It's not a specific. You're talking about sensitivity and specificity. So if I see a pressure that's low, I wouldn't say they're just dehydrated.
Of course not. What would you do?
I would make an assessment, and that would
And
deal
not
with
do anything
physical
else?
history and everything else, not just from a blood pressure.
So how would you determine whether a patient's dehydrated?
Oh, several ways. First of all, looking at them, you can see their mucous membranes are dry.
Okay.
You can look and see how much their urine output was over the last 8 hours or so. 30 cc's over an hour or less is dehydration by definition.
Okay.
So if her urine output's low, there you go.
What else?
That's the main thing.
Okay.
Because the kidneys will put out, just like we just drank these fluids, we're going to put out
Got it.
within an hour or so,
Right.
unless we hold it.
Hopefully, yeah.
Yeah.
So, of course, you didn't examine Angel Milan on the 21st, true?
I don't recall.
Well, you didn't see her on the 21st.
That's the day she came in.
Yeah, I don't recall. I don't think so.
Okay. So you wouldn't have any idea whether her mucous membranes appeared dry, true?
Yeah, no.
Okay. And you also didn't look at her urine output,
Right.
right? So you don't,
But most,
well, let me,
okay.
okay.
Most
Go ahead.
pregnant women are dehydrated, and thus proven otherwise. We're dehydrated without an additional person to supply vascularity for.
Got it.
So if she has herself, the baby, and it's May, hot weather,
Right.
she's more than likely dehydrated.
Okay. So, you didn't know her urine output on the 21st?
No, because she would have to be admitted, and then we observe it over time.
Okay. But you didn't observe it, true?
No.
Okay. So you wouldn't know that either,
No.
true? Have you ever heard of taking someone's pressures, both lying down or seated and then standing up?
Yes,
Does that
that's
ring
the
a bell for you?
orthostatic.
Okay.
But that's
And
not
what is it?
dehydration, that's orthostasis, which is totally different.
That's right. But in your testimony, it's not indicative of whether a patient's dehydrated?
Orthostatic, when we came in here this morning, we were dehydrated, but we weren't orthostatic.
Right. Oh, but so your testimony is that taking orthostatic pressures is in no way indicative of whether a patient's dehydrated.
That's
True?
not my testimony.
Okay.
The testimony is orthostasis and dehydration are two separate entities.
I agree with you.
One's more severely serious, and it's actually an ER situation, and the patient probably would be almost unconscious and kind of obviously in that state because of her presentation. And then the other one is subtle, and you wouldn't know until after, a prolonged or more long observation.
Tell me what pressures, if you tested a patient's pressures, lying down, seating, standing up, would indicate to you whether a patient was dehydrated.
Well, definitely if their heart rate, it's not just pressures, it's the heart rate as well.
Right.
If their pressure drops upon sitting up or standing, like 20 millimeters of mercury or more,
Right.
then that's significant.
Significant for what?
Orthostasis. And if their heart rate increases as well. So it's not just blood pressure like we had.
And that would be indicative of someone who's dry?
That definitely dry and probably
Okay.
would need blood or whatever else.
Okay. Thank you. You mentioned in the record that I think you brought some of the patient's, Angel Mallon's, Grady medical records. Is that right?
Yes, I have them
We'll find them.
somewhere.
Let's see. I'll help you.
Yes,
And that's all right. Exhibit 3, right?
yes.
And she had been at Grady from when to when before you first saw her?
Oh, I don't know the beginning, her first visit.
Okay.
I don't know that. And I can't tell immediately from their electronic medical record system.
Uh-huh.
I don't see the first date. I can look for it. But what was your question?
Well, take your time. Which one?
I mean, they have records on here from December 2011. Or what is that? Yeah, so that looks like maybe her first.
Okay.
December 19th, it looks like. I'm not sure if that's the first, but that's what I see here.
Okay. So from December 2011 until May of 2012 is about 6 months, is that right?
Yes.
And what was her estimated date of confinement, if you...
They have the absent in this record right here. On that one flow sheet, they had it missing, so I'm trying to search for it. They didn't fill it in there, but I'm trying to search for which one they were using. They were calculating gestational age, so I wouldn't be able to comment which one they were using. If I find one now, I can just
Get a
tell you
new one.
which one is on the ultrasound.
Okay. I mean, it's in many places. I'm happy to look at it for you. It's in the admit. Oh,
Okay, but that still wouldn't let us know which one they were using on that. We'd have to calculate with the wheel which one, because there's several, and we look at it as an obstetrician, and then we use one on the flow sheet. So
Right.
that would just tell you what what they calculated from whatever record you obtained it from, like the radiology department. They don't always use that one. Let me see. Here's her.
here it is in your record. If you look at 0028, do you have that?
Back to this one, or
Yeah,
no,
I'll-
this one?
I'll
No,
get it.
out of the Grady medical records. I don't know where that is. What does it say? You can tell.
Look at it. Yeah. It's June 2012.
Okay.
A stapler, Paul.
What's that? Stapler?
Stapler or clip.
I don't have one handy.
We can admit the whole record, but we may as well just.
Staple at a break, I just don't have one in here.
What's that? Here. All right, tell you what I'm going to do. We're going to mark this as number 10, which is a portion of the Southfield Medical Center record for Angel Mylan. Mike, I have some more stickers. I'm going to go ahead and make make 10.1 SFMC 0028, 29, and 30, which appears to be your history and physical for Angel Mylan dated May 21st. 2012. Is that right?
You need your copy back, I got one, Jim.
That's fine. Well, we'll mark it anyway. But yeah, that's fine. Do you want to use
So
that
you
one?
look on,
Okay.
same thing.
Okay.
Excuse me. First of all, this is your history and physical for Angel Mylan, dated May 21st, 2012, true?
It looks like that, yes.
And that's pages SFMC 0028, 29, and 30, right?
Yes.
Okay. And that was the date of admission was May 21st, 2012?
Yes.
And looks like you dictated that on May 24th, 2012 at 13:36. Is that right?
Could be, or, yes, that's what it looks like.
Okay. And it was transcribed about 3 hours later, 2.5 hours later, on May 24th, 2012 at 16:05, true?
Yes.
And then you confirmed the dictation by your confirmation number 2831749 on May 24th, 2012 at 18:29, true?
Mm-hmm.
Yes?
Yes. Yes.
So that would have been another 2.5 hours later, true?
What would have been another 2.5 hours later?
You confirmed that the report was accurate about 2.5 hours after it was transcribed.
No.
Okay?
That number just goes in to show the identity of the person that, the physician that the transcriber is dictating for or typing for. That wasn't a confirmation that
Okay.
I'm aware of.
Well, you read it on May 24th, 2012, true?
I guess. I really don't remember. I don't know what these numbers are
You
down
don't,
here.
you don't know what the letter R stands for, whether that stands for red?
Don't know.
You
I'm not
agreed?
familiar with reading these.
Okay. You read your notes?
Yeah, I read my notes.
Okay.
But these numbers down here and everything, I don't know what they're standing
Okay.
for.
You understand DD to be date dictated, true?
I understand it if you say that's what it is. I didn't know that beforehand.
And DT is date transcribed, true?
That's what it seems like, yes.
Okay. And the R, you don't know what that stands for?
No.
And this confirmation number, you don't know what that is?
Not right now, don't recall.
Did you have a dictation ID when you were there?
That's what I was saying, but that would be on the date of dictation. You're talking about a day later or so, right? Or 2.5 hours later?
Yes,
So
ma'am.
that wouldn't be when I dictated.
Okay, when you dictated it, you used your dictation ID, true?
Right.
And that your dictation ID in May of 2012 was 6475028, true?
I don't know. I guess so.
Okay. And
Don't guess. You don't have to guess.
Yeah, I'm not sure.
Now, if you look down at the bottom, it says authenticated and edited by Lilith Whyte, MD, on May 26, 2012 at 4:25:09 p.m. Central Time. True?
Yeah.
Okay. So you made edits a couple of days later. True? On May 26th.
I don't know that I made edits. They may have gotten it totally correct, but I looked at it and confirmed it on May 26th.
Okay. It says edited, but you didn't edit it.
When they say edited, I think that's their just term that the computer uses for looking at it and editing if it's indicated.
Okay.
Doesn't necessarily mean you made a change.
And then on SFMC 0030, which is the third page of your history, I reviewed the history and physical and examined the patient, no changes, right?
Mm-hmm.
Yes?
Yes, I'm sorry.
And then you didn't date or time that note. Why is that? Okay.
I'm sorry.
That's all right. So do you know what date and time?
I don't. No, definitely not now. I don't know.
Okay.
2 years later.
All
2.5
right.
years.
And your note here, sent from, what does that say?
Atlanta Perinatal Associates. Yeah.
The perinatologist,
Yeah.
true?
Mm-hmm.
And that little P with a line over it, that's with, right?
After
Oh, after?
evaluation. Yeah.
After evaluation from Dr. Page, true?
Yes.
And he's a perinatologist, true?
Right.
And you respect him?
I'm trying to figure out what does that mean?
You respect him as a physician?
I hope so.
Yeah, I mean, you refer him patients, right?
Yes.
Because you trust in his care, his opinions.
Yes.
Sure. And you're not a perinatologist, true?
No.
A perinatologist is, you're an OBGYN, true?
Yes.
And to become a perinatologist, you have to go through additional education and training. True?
To get any specialty you do, but there's specific additional education they get. They're an obstetrician gynecologist as well.
Correct.
Yeah. They just do more sonographic education than we do.
Well, not just
that-
sonographic education.
That's the basic distinguishing factor.
Okay. Dr. Page has more training than you do, true?
In
Perinatology.
yes, because
Okay.
I'm not a perinatologist.
And you've got parenthetically perinatologists who informed us no end diastolic flow, true? True. And that's what you were told on May 21st, 2012.
True, absolutely.
And no end diastolic flow means what?
Growth is severely restricted. That's what that test is for. That's why it came out.
What growth is severely restricted?
Well, Doppler studies are for fetal growth. That's what they're for.
Mm-hmm.
Okay.
But no end diastolic flow.
Meaning the baby's severely growth restricted.
Okay. Can you tell me, do you have a site for that? I mean, any,
You look it up anywhere. You actually send my textbooks, but you can look it up on ultrasound and say, what's the role of Doppler studies, and they'll tell you it's.
well, that's a little different from my question. My question is what no end diastolic flow means.
Well, when you get the roll, then they'll tell you what the abnormalities and the bad and the good.
Right. And you agree that no end diastolic flow is an abnormality? True?
Yes.
That's an abnormal
Severe
test result.
growth restriction.
Okay.
That's what it is.
And you said text. What text do you use?
That's obstetrics and gynecology Williams,
Williams?
which is the textbook, and then the ACOG bulletins,
Okay.
the technical bulletins they put out yearly to tell you what the updates are.
Okay.
And
Anything
actually,
else?
the recent one said there's no role for Doppler studies in fetal outcome.
Have you ever heard of guidelines for perinatal care?
Oh yeah,
Put out by the American Academy of Pediatrics?
exactly, and it says the same thing.
Okay. And a BPP of 6/10, see report attached. True?
I just missed that.
That's okay. It's 30.
What page you on?
See report attack, yeah.
Yeah.
0030.
Okay. And by the report, let's pull it. And we're going to go ahead and mark 10.2. Flip over to 129.
These aren't in order. So
So,
these are in a different order.
you can
than
use
yours.
mine.
Okay.
Looks like Dr. Page's obstetric ultrasound report goes from SFMC 0129, 130, 131, 132, 133, 134, 135, and 136. And we've labeled it as 10.2. Is that right? What was that other report? Yeah, but I need to get that. Just, I mean, I can figure out what No, the other. Oh, that was autopsy. You waiting on me?
Yeah.
I'm sorry. That's a report that you were referring to?
See attached?
Yes, ma'am.
Yeah, I guess. I can't remember.
Okay.
Let's see.
Was there another report that you're aware of?
I don't recall.
So any reason to believe it was any report other than that one?
I don't think so.
Okay. And then if you look at, if you flip back over to SFMC 0028, it looks like you've got an estimated date of confinement of June 12, 2012. Is that right?
Okay.
That's in your.
That's in here,
H&P.
right?
And they're all in there too. If you
Okay.
Keep that one open. So
Okay.
He's going back and forth. He's talking about your H&P.
Okay.
all right up here.
Yeah, I see it. Uh-huh.
Okay. So the baby was due in June of 2012. True.
Yes. June 12th. Mm-hmm.
And the mother started getting care in on or before December of 2011 at Grady. True.
That's what it looks like. Mm-hmm.
So the mother had been receiving care, let's see, December, January, February, March, April, May, June, about 7 months. Is that right?
Well, that wasn't June. The baby was delivered May 21st, and she got care December 19th, so that's not 7 months. That's 6, because mid,
Okay.
yeah,
So
that's
as
6
of,
months.
right, and I was, okay.
So 4 months, she was a late prenatal care registrant, once again with her noncompliance with the prenatal care.
Say again, I'm sorry?
It's a 10-month prenatal care package. We give you a 40-week due date.
Okay.
So you just calculated 6. So the first 4 months, she didn't find the importance as a HIV positive patient and a
Okay.
diabetic to seek a prenatal care provider.
Do you know when she learned she was HIV positive?
No, I don't.
Okay. No idea.
No idea.
And do you fault Angel Milan in any way for her baby's death?
I don't fault anybody. Why I know she should be more responsible. I think that's
Okay.
clear to anybody that will review her noncompliance.
Okay.
Because there's just like you read in the preamble of the bylaws, there's bylaws for pregnant patients to take part in their care. The doctor can only do so much. They have to eat right, they have to come into the appointments, they have to abide by the prenatal care treatment and take their medicines or whatever we're suggesting and recommending.
Okay. So Angel Milan's partly responsible for her baby's death?
Sounds that way to me.
Yes.
Yes.
Okay. All right. How was Angel responsible for her baby's death other than what you described as the late prenatal
That's the
care?
most significant part. I mean, that's the most significant part.
Okay. And you mentioned some bylaws for pregnant patients. Were those at Southfield Medical Center?
No. I was just kind of
Got it.
facetiously saying she has bylaws that go hand in hand.
Okay. All right. Well, we were we were getting to the estimated date of confinement, and we found the one in your note. So
Yes.
it was June of 2012. You have the Grady note there for October 14th, 2011.
Let's see.
What does it say? 'Cause I don't, this is all,
Take your time, or I can help you.
okay. I can hear it, and I don't have to see it.
It'd be 20-year-old G3P 0020 at 5 weeks, 3 days by LMP 9611, EDD 61212. Presents with complaints of lower abdominal pain for 5 days since finding out she was pregnant.
Okay, I have a question then.
Okay.
What is that you're reading? That October?
Yeah.
Where
it's
was she there? Where was she, what hospital was she at there?
Grady.
Okay.
Do you have that record there?
No.
Let's see.
And her 2 other pregnancies, were those miscarriages or abortions?
Miscarriages.
Okay.
You didn't know that before today?
Absolutely, I would have known that, but it's 2.5 years later, so
You
I
just
don't
may have
think I could
forgotten.
remember
Got it.
Angel Milan over everybody else.
You said you found out October 11, October visit.
She had miscarriages.
She said she wanted to make sure the baby's okay. She's had 2 miscarriages in the past, 2002 at 3 months and 2010 at 3 months. You don't remember that note, or?
I wouldn't have done that note. I wasn't at Grady.
No, I know, but you said you had the Grady records, right?
Yeah, they may not have sent everything.
Okay. Yep, we've seen that.
Yeah, but I'm still trying to
Well, we're going to
answer the
find it. We're going to get the
question.
note for you if you have it. Let me pull it up.
I don't know how much I could answer. It has not, I mean, I don't, you know, I didn't have the patient on October 2011, so.
Yeah, I know,
I'm just
but
trying to figure out.
If Angel was seeing a physician regarding her baby, you know, in early October or even earlier, let's see, October, November, December, January, February, March, April, May, June. So with an estimated date of confinement of June 2012, then she was actually seeing a physician for 9+ months, right?
No, because
Okay.
it's mid-October, so we'll go November, December, January, February, March, April, May. That's 7 months. Because it was like mid, a little later than mid, maybe a week later exactly, the
Okay.
21st that she delivered. So it's 7 months and a week exactly.
Okay.
Okay.
Which you would still fault her, at least partially, for the failure in the prenatal
You know
care.
what? The treatment, the time that you come in for your initial visit has some part to play in outcome, but if you are non-compliant with visits after that and
Yes, ma'am.
treatment, I think those are more crucial than your first visit to the prenatal care doctor.
Okay.
If, you know, they didn't see her after that a couple of times, as they mentioned all in the notes that I have. I don't know, those are more computerized, but I think because there was a continuity of care, I saw other notes that they made sure were in there and told me how she was non-compliant, which she admittedly, you know, stated on, you know, entry into my office, and what she admittedly stated in the entry into the hospital that May 21st, that she didn't even take her antiretroviral. So her first visit to the prenatal care doctors, really, that's really so below the surface right now. The surface issues are you didn't take your antiretroviral. You're, you know, high risk with the HIV and diabetes, but you didn't see fit to not only not take your meds, but you didn't come into the doctor.
Okay.
You know, you have several missed appointments.
Right. So, and all of those caused or contributed to the loss of the baby?
It's just that if there was a closer surveillance of things, you know, she probably could have done better. I mean, we can all speculate. We don't, I mean, it just makes sense that she would have done better.
And I'm not asking you to speculate.
Yeah.
So, the things that Angel did and that in your view caused or contributed the demise of her baby were the antiretro drugs with the positive HIV, the doctors and the missed doctor's appointments.
And it's not just the antiretroviral. She was diabetic as well. So if there was noncompliance with medication, that's
Okay.
diabetic medication.
Okay.
And of course, stillbirths are a highlighted complication with diabetics.
Okay. Anything else that you can think of now?
No.
All right. I don't know if you have the November 15, 2011. What?
All these are December.
2011. Do you
That's
recall?
so sad that doesn't-
I can show it to you. That's fine. Thank you. So, have you seen any Grady records other than those?
I'm sure I did, but like I said, it's 2.5
Got it,
years ago.
got
And
it.
the only thing I remember is my,
Got
my
it.
synopsis of the
That's
whole
fine.
thing once I read it. Non-compliance, non-compliance,
All
non-compliance.
right. Do you recall on November 15th, 2011, Dr. Gary and Sheila Smith made Angel aware that she may be a newly diagnosed HIV case?
No,
Okay. Today's the first you
yeah.
heard of that.
And then I guess the key there is maybe,
Uh-huh.
because they don't have a negative one before, so they don't know if she knew before or not.
Okay.
They're dependent on her credibility, which
Okay.
seems to be an issue here. But anyway,
Yeah.
so if she's HIV positive there, that does not tell us that's the first time she was HIV positive. That's when she was diagnosed. Because
Okay.
we don't have a baseline to show when she was negative.
Right.
She could have been positive 2 years ago, and they just picked it up when they saw her.
Mm-hmm.
That doesn't say anything.
Okay. But if you would expect her to take meds if she didn't know, right?
Well, who says she didn't know? From what I just stated, she could have had a positive test somewhere else and been positive. And just, of course, nobody's very forthright with telling that they're positive.
Right, but that's a little different from my question. You mind reading back my question, please? He's going to read you back my question.
But you wouldn't expect her to take meds if she didn't know, right?
Which wasn't the case, but yeah, that would make sense.
Okay. Do you consider Angel Milan to be dishonest or untruthful in any way?
I don't know her personally, so
Okay.
I wouldn't know that.
Okay.
I can only go on what we're seeing, as of the time we had relations with her.
Okay. Well, did you ever know her to be dishonest or untruthful with you?
Yes.
Okay.
I
Tell
had
me
to get
about
the
that.
Grady records later. She was not forthright with all of these other incidents. She just told me she wasn't happy with their care. I had no idea she was non-compliant there.
Okay.
Because when a patient first comes in, sometimes we don't have the records immediately available.
Right.
So when I got them after the first or second visit, because Grady's a big institution, it's
Right.
hard to find somebody's records and
Right,
send them.
right.
I said, wow, it's a little bit different picture from what she painted when she came on her first visit. It's a big picture difference.
Right.
HIV should be something maybe she did tell me, I can't remember, but you didn't tell me you were non-compliant, because I probably wouldn't have picked you up as a patient
Right.
in your last month or so, 2 months, whatever it was,
Okay.
of, delivery.
And whether she told you about that would be in your office records, right?
No, you mean saying the compliance versus non-compliance?
Well, HIV compliance.
I wouldn't have written
not-
anything about that on the first note, because I would try to hopefully feel that the patient was credible when she came to me, so that would not have been written on the office note.
Okay.
That would have been something I, saw later.
Okay. All right. December 4th, 2011, do you have, December 4th, 2011, do you have that note?
This?
Yes, ma'am. The Grady.
Okay. Remember I told you it started with December 19th?
Okay, so you don't
So
have
I
that.
wouldn't have December 4th. I see they provided everything for you, because we didn't get all this.
Okay. March, do you have the March 6, 2012?
looks like all December 19th.
Don't have that either.
No,
Okay.
I don't have it right here. No.
What about April 2012? Let's see.
You can just refresh my memory what it is. there.
Sure. Do you have any April Grady records?
No, not right here, right now.
All right. Let's see. Do you have the? Let's go ahead and mark the April 24th. Well, if you can. Do you have the 4/24/2012?
We have all this. He's got Jim, are you in Grady records, or what are you asking?
No, we're going back to Southfield Medical Center records.
Okay.
Oh, that's right here, right.
Which admission, Jim?
April 24th, 2012. That's probably easier.
21st.
This is the 24th.
Okay. Okay, good
What
part.
do you
Progress notes?
Huh?
What are you looking
Progress
for there?
notes? or-
Yeah. I think it's yours.
Okay.
Do you have your note for April 24th?
April 25th? Mm-hmm.
4th or 5th you have
25th.
there? Okay.
Mm-hmm.
And for the record, that's Southfield Medical Center
Yeah.
0232, right?
Yes.
And you've got an estimated date of delivery of 6/12/12, right?
I didn't put that on there at that time. But yeah,
Okay.
that's not on here.
Let me see what you're looking at. Is there stuff in here I don't need to
No, you can look at it.
progress? Do you have an admit note or?
Yeah, let me look for that. I can see.
No, I got it out of.
Okay, that's probably what the 24th was.
Maybe an H&P.
Oh, this is, it says history and physical, so I was thinking it may be under here.
Yeah. Is it under there?
I don't know.
I'm sorry.
Doesn't look like it. Where, okay, yeah, well,
That's your office.
yeah. Okay, well, you want to tell us? what
Sure.
you're saying? 'Cause
I mean,
kinda-
I'm looking at 4/24/2012. Your
Okay.
note? Do you have your note?
No.
I can pull it
What
up.
about
Hang
it?
on. You don't have a note for the April 24th?
Not right here.
I'll pull it up.
Oh, wait a
I
minute,
think
who
she
is
saw
this?
the patient in the office that day.
Oh, yeah. Right, but here's the perinatology note too. Let me see.
There's an
So
office
sure.
record, and you sent her over to the hospital.
Okay, let me see what that
Did
was.
you just, if you just saw her in your office that day?
Oh, I see what happened.
Okay.
This is another example of her noncompliance. On the 23rd, she was seen in the office with a high blood pressure,
Right.
and I have sent to South Fulton Medical Center. So
Got
I
it.
trusted her to go over,
Okay.
so she didn't.
So your record on the 24th?
This is the 23rd, and you're reporting something on the 24th, so that means she just took the next day and went. Maybe she had to, I don't know if she had another appointment somewhere, she didn't take this seriously, but it doesn't look like she went into the hospital to the 24th.
Okay.
So she never came to my office,
But
on
did-
the 24th.
Yeah, but you saw her in the hospital on the 24th, right?
It depends on what time she got there. If she gets there at night, we see him the next morning. You know, I don't remember. I don't know when she got there. I mean, when she, oh, that's, okay. Yeah. Okay. All right, so yeah, she got there, should be one.
Sorry.
Yeah, so she just didn't go, and that's why there was some confusion. She didn't go in when she was sent and instructed to, which was on April 23rd.
Come in. Somebody knocking.
Find it? No, I'm looking for
Called you on the 24th.
I mean, it's been on call.
24.
Hers is,
Let me see.
because you saw on the 25th.
Yeah. Was it,
Ours was the 27th.
where's your calendar? What date was the 24th in 2012?
Figured it out.
What date?
I'm gonna pull it up real quick. So, all right, 524 admission. That's discharge summary.
What year?
Okay, it was on Tuesday
No,
or Monday.
it's Thursday.
Monday. Oh.
Oh, wait a minute, April, sorry, my bad.
So what is it, 24th? Yeah.
24th was a Tuesday.
Okay.
You wrote your note on the 25th.
You have 0220 there.
What is it, Jim? I'll try to find it.
I'll find it for you.
Oh,
Is it in the,
It should be in the 24.
you know what may have happened when she went? It looks like, I don't know.
I got it.
You got it?
It's the
Okay.
24th. It's right there.
Okay.
Yeah, let's just show you what's been, well, we'll mark this. 10.3, which is SFMC 0220, 0221, 0222. Let's see, this is it still. 223,
Okay, I see it.
4, 225. See that? Does that help get you there?
Okay.
All right, that's April 24th, right?
shape this? I'm showing her something on the 24th, Jim, just.
I mean, this is like not a big point.
Yeah.
Oh, this, I tell you what
Okay.
this is, because this is discharge.
Help me out.
Let
Yep.
me tell you what that is.
Got it.
She didn't go in the 23rd.
Yes, ma'am.
But when she comes back the next day, it's not an admission, so there won't be an admission note. It's just an evaluation in the labor and delivery suite. So unless they find reason to admit her, they didn't. They said she's great, Dr. Whyte, she can go home. So when I come back the next, whatever, within that time
24th,
period,
yeah.
and, just kind of summarize what they told me and go over their fetal strips and everything. Because we see it right here that they talked to me, called me like they do the
Right,
doctors.
right.
Your patient came in, blah, blah, blah. She's doing fine. What did they say?
No.
Updated on patient, reactive fetal heart rate pattern, and no contractions at the time. Blood pressures are normal, headache resolved.
What are you pointing to, Paul, for the record?
It's SFMC QS 0115.
Okay, so that's the electronic medical record.
I'm pointing to a
Right,
note.
exactly, but it's summarized, and I'm just giving you
That's
the summary
fine.
of
I
what went
don't-
on. So she really didn't get admitted.
Okay, so
Yeah.
help me with that. What happened
Okay.
is, go ahead.
When they have an assessment,
Yep.
then when they come in, they think they have a problem.
Yep,
And then you see if it's really a problem.
right.
Like they may even say they didn't feel the baby moving, you bring them in, you have the strip and it shows a reactive NST, and then after that you say, oh, your baby's fine, and then they go home. So that's not an admission. And
Well,
the
but you didn't
physician-
you sent her to the hospital, I thought.
That was the 23rd. She never
Right.
went.
Okay.
Okay, and I didn't send her for admission. I sent her for evaluation, further evaluation. They usually-
Evaluation how? Some tests
blood
or?
tests,
Okay.
non-stress tests, things I can't do in my office. Biophysical profile, and if those show, because one blood pressure doesn't mean anything. It could mean,
Okay.
if the patient's hysterical that day, or maybe something made her mad at home and she came in. So I wanted to, just evaluate that.
Okay.
So she was supposed to go in. Actually, I probably would have said sent to the South Fulton Medical Center. I just said sent to South Fulton Medical Center, but I probably would have said keep her over 24 hours. However, she never went in on the 23rd.
Over 24 or under
I mean,
20?
keep her at 24
Yeah.
hours and admit. That would be admission,
Right.
24 and over.
Right.
But anyway, she didn't go, so she just came in on her own without a physician order, the 24th.
Well, she came in on your order the following day.
No, because the order, it wasn't, I didn't write an order.
Okay.
We usually tell the patient, go over to the hospital, and I call the nurse and say she's on her way.
Got it.
and no orders written till the patient signs for treatment, which is the routine of every hospital. They come in and they sign the consents. But she never went in, so there
Okay.
was no order for her to, follow through with, because she never showed up on the 23rd. So
Okay.
she came the next day,
The
which is what I
24th,
was explaining
right.
to you before. She's non-compliant. She
Okay.
does what she,
Okay,
self-treatment, I don't know. But she went in the next day.
yeah,
So that's when the nurses evaluated her,
uh-huh,
and like they do any obstetric patient that walks in, and they say, oh, this lady came in for whatever reason. I guess she thought she was contracting or whatever. Her blood pressures are normal. Her, there's no contractions. The baby's reactive.
okay. And even though she wasn't admitted, you did an obstetric discharge summary for her for April?
No, that's a routine. That's routine. We always have to comment on what happened with the patient that came in. So we go ahead and review the record and then comment. She came in 33 and this is what date?
April 24th.
Okay.
Let me finish my question, though.
Oh, okay.
Okay.
Sorry.
So although she wasn't admitted, you sent her over there for tests, and you prepared this obstetric discharge summary on April 24, 2012, true?
Not based on the April 23rd at all. They don't tie in at all together.
Right.
Because she didn't follow through with the April 23rd recommendation.
Okay. So on April 24th, she had some testing.
She went in April 24th as a walk-in, and the
Right.
nurses do the general assessment, which is see what she's there for.
Okay.
And she apparently was trying to let them know she was ruling out labor, so they thought it was important to tell me the baby looks good, her blood pressure's, and she probably told them my blood pressure was elevated in Dr. Whyte's office on the 23rd, and they told her they're fine now.
Okay.
So no contractions, baby looks good, send her home.
Okay. And you had a note, history of stillbirths there too, true?
Where's history? I don't know, where's that?
Height 70, weight 310, BPP 10/10.
Okay, I'm sorry, I don't see where you
We'll look
are.
at 222. Is that
Okay,
your?
that's not my note. That's
Okay.
the perinatologist's note.
Okay.
And obviously, here we go again. Let's stop and go back. This is significant again. She tells this perinatologist there were stillbirths. And you pointed out earlier that she told Dr. Gary, the perinatologist at Grady, that she had miscarriages.
What's
Those
the
are two different
difference?
things.
What's the
Well,
difference?
miscarriage, first of all, the way they wrote it, 0020, it's an acronym for PTAL. TPAL rather. Term, which is 37 weeks and beyond. Preterm, which is under that. And then abortion, which is under 20 weeks. And then living. Now, a stillbirth cannot be defined as a stillbirth till you're past the 20-week mark. So Dr. Gary, I know, is a board-certified perinatologist that wrote that, looks like where you gathered that little acronym, para 0020. So that was a miscarriage, which
Okay.
means it was under 20 weeks. That's what she told him, I'm assuming, from what they wrote and what you just read off to me, what you gathered and researched. But yet here, this perinatologist at Dr. Page's office, she tells,
There's Dr.
they-
Page.
this isn't Dr. Page's handwriting.
No,
It doesn't look like, but I don't know. I can't remember, but
On
it
May
doesn't look like it. This right
Okay.
here, not May.
Go ahead.
This isn't May. This is April 24th,
Okay.
April 25th. She tells that perinatologist, because that's the only way he can get his history from what she tells him, that she had stillbirths.
Okay. So if Angel Mullen told one physician she had 2 stillbirths and another physician she had 2 miscarriages, that makes her a liar?
It just makes her not a credible person, because she wouldn't use the miscarriage and stillbirth. We would deduct what it is because we're the doctor.
Right.
But she would have told him, oh yeah, the first one was at 8 weeks, 20, whatever, less than 20. And now she's telling this perinatologist, oh no, they happened, the baby was alive, and the 2 came out and they weren't, viable or whatever.
Where are you getting that information? What she told them?
Okay, because this
No,
is
I want to know. First, I want to know where you're getting the information you just shared with us.
Okay, let's rewind. You just told me that I wrote stillbirths. So we went to the note, and I saw where the mistake was derived from. Because
Okay.
you read a perinatology note that you thought I wrote.
Yes, ma'am.
Okay. So that wasn't me. That was the perinatologist
Well,
that wrote
the
stillbirths.
discharge note's yours, right?
The discharge doesn't have the stillbirths on it.
No, but the discharge, the 2 pages prior, or
Exactly.
your
I was
notes,
just
right?
answering the question about the stillbirths.
Okay,
The
all right.
perinatologist wrote the stillbirths.
Okay.
So it was significant for me to point out right here, once again, which now, instead of non-compliance, we're dealing with credibility.
Okay.
We have two
I mean,
board certified.
dishonesty.
Check the form, let her answer the question.
We have two board certified perinatologists. So they would have been able to conclude what she meant by the two pregnancies she had. And we have Dr. Gary that said there were miscarriages on his records from what she told him at Grady in October. And then you have here in April, she told this perinatologist they were stillbirths. So I just said that's just conflicting information. That's all I'm noting.
Okay. So if someone, and you hadn't looked at the October Grady record, right?
No, I didn't have to because you already told me the content that we're talking about.
So if she saw a physician at Grady in October 2011 and said she wanted to make sure the baby is okay since she has had 2 miscarriages in the past, 2002 at 3 months and 2010 at 3 months, that would make her, what, dishonest for saying that?
Okay, that's an incomplete thought pattern.
Okay.
Because then you have to show something that disagrees with that, and all you showed was one side. So you have to have two sides to show that they're conflicting, to show that somebody's incredible. They're
Okay.
not credible. Okay.
And Angel
So all
Mylan's
you
not
told
credible.
me was no. I don't know that. We can.
Well, I
If you
thought you said
conclude
she
that,
was
you conclude that
earlier.
from this, then that's your conclusion. But what I'm saying is, the first perinatologist, and now I'm glad you were more specific because that just goes what I said.
Thank
3
you.
months. So that's 12 weeks. That is a miscarriage. But this board certified, now you just talked about Dr. Page being reputable, so I'm sure he wouldn't hire somebody that wasn't reputable. They wouldn't write stillbirth down here if it didn't meet the definition of stillbirth, which is beyond 20 weeks and beyond.
Okay.
So she had to tell him that. When she just went in October and told that perinatologist it was 3 months that these babies died.
Which makes Angel Mylan less than credible.
It's either she's not credible or either she's very confused.
Okay.
Because those are two different pieces of information. And if that's something that's so catastrophic, which would be to any woman, you would think you would remember that.
Okay. All right. What else?
There's not a pending question.
Was that the extent of your explanation, or?
No, I'm just saying the stillbirths were just one thing and the miscarriage is something else.
Okay. All right. Now you have the April 27 record there.
Is it in the notebook, Jim?
Yeah, I mean, you
I've
can
got
use
it
that one, that's
separately
fine.
somewhere.
I'll
I
mark
gotta
it.
find it. Don't need to spray this stuff right now. What do you want in the April 27th one? Here's the record. I don't know what he wants.
You have an admit note there.
Okay.
It's probably in the H.
That's the one we went over earlier. No
Oh.
fetal movement, 1 or 2 days. Do you see that?
Yes.
Okay. And you're looking for the record Southfield Medical Center 0282, right?
Yes.
Which is an admit note for April 27th, 2012, right?
Yes.
Which is a little over 3 weeks before May 21st, 2012, right?
Yes.
Okay. And you had access to those records as well, right?
I don't recall, but I'm sure probably.
Okay. And it reads there was no fetal movement for either 1 or 2 days, 3.5 weeks before the May 21 visit, true?
True.
21-3. And if you look at 280, 2 pages before that, SFMC 0280. This is Dr. Braswell's discharge summary. You saw that as well, right? You had
I
access.
can't remember it for right now. But
Okay.
this
Do you-
is out of order, but just tell me what that said.
Okay, we'll go ahead and mark this as 10.4 to your deposition. Let me, on that You see the BPP 4 out of 8 on that day,
Yes.
right?
Yes.
Do you see admission diagnoses, intrauterine pregnancy at 33 plus weeks, true?
Yes.
BPP of 4/8
Yes.
with normal reassuring.
Yes.
You agree a BPP of 4/8 is not normal nor reassuring, true?
True, but to comment on number 2, she
Uh-huh.
could have been talking about the non-stress test that we spoke about earlier in length
Right,
to make that 6 out of 10.
right. Have you spoken with Dr. Braswell at all?
No, I have
Okay.
not.
Discharge date, discharge diagnosis, BPP of 4/8, normal reassuring, right?
Mm-hmm.
You agree a BPP of 4/8 is
That's a
not...
comma, so
Let
I'm
me-
not
Let me finish that.
Yeah.
You
Okay.
agree that a BPP of 4/8 is neither normal nor reassuring, true?
True. But can I respond on that?
Sure.
The comma with the normal reassuring may be not referring to the 4 out of 8 component of the BPP, and she may be referring to the non-stress test, which brings the score up to 6 out of 10, because a BPP is out of 10, it's not out of 8. So she was responding on the radiology component of evaluation and the normal reassuring when the labor and delivery component was added, which was 6 out of 10, sounds like.
Can you show me there where it says the NST was reactive?
See, remember I told you I hadn't looked at these notes. I just remember her stating that to me, and I'm sure I think I saw 6 out of 10 in one of her notes, which would have accounted for the NST. I don't know. I'm not familiar with your records here, how to look for.
Here's your progress note.
Okay. Because this is the one where it was 8 out of 8. 10 out of 10 or 8 out of 10. I don't see the one before. I can't comment on that. I don't know. I just know nobody would leave a patient in there for 4 out of 10 without.
Okay. Atlanta perinatology. Let's see that. Thank you. Now, move on to Dr. Page's report, which is
And I remember
012.
that one, so you don't have to find it. I remember it.
Okay.
I just
Well, I'll go
saw
ahead
it.
and mark it just
Oh,
so
okay.
when everybody goes
'Cause I
back
just
later.
saw it.
That begins at page 0129, and we've actually already marked that 10.2. Sorry.
Okay, you can use this one if you want to.
Okay.
Sorry. It's dangerous. Right, and this is Southholt Medical Center 0129, which we marked as 10.2, which is the perinatologist's report, right? And that was the one attached to your history in the medical record that we referred to earlier.
Okay.
And it reads here, fetal heart rate of 125 BPM, true?
Let me make sure we got the right document, Jim. This is
Should be 129, starts at 129.
Yeah, 1:25 p.m. What
Okay.
date do you have?
It should be May
5:21?
21st.
Yeah, we have that.
Thank you,
Okay.
you got the right one.
All right, fetal heart rate of 125 beats per minute, right?
Yes.
And this is on 5/21/2012, true?
Right.
I mean, you agree if the baby had a fetal heart rate of 125 beats per minute on May 21st, 2012, shortly before you were called by Dr. Page, the baby's very much alive, true?
Not necessarily.
Okay. Tell me.
I know you feel
Well, I
like,
wanna-
where do we go here?
All right, I want you to. Have you ever had a baby with a baseline heart rate of 130 to 140 that was dead?
Yes, absolutely.
Okay, tell me about that.
2 cases. Can't remember.
Okay.
Can't remember the people exactly involved. You know, the patient. But actually, in residency, I saw 2 cases.
Okay.
And it was explained that until the detachment of the umbilical cord, sometimes you can get like a life support effect.
Okay.
Where the heart can be supported depending on the timing of the death, but the heart can be supported by the mom, you know, because it's still connected to the machine. The baby's dead, maybe brain dead, whatever, you know, that's still all something that's not really clear in the medical arena. But yes, they can have that life support effect still being connected by the umbilical cord before it's cut. I've seen it.
Okay. So the baby's heart, the baby can be dead, but the baby's heart's still beating. True?
Well, the machine is the mommy and she's viable, and the baby's connected to a viable source.
Okay. So the baby can be dead, but the baby's heart's still beating. True?
It sounds like, yeah.
You
Yes.
said yes?
Yes, in those cases, that's what we saw.
And
And you see, you know, I'm trying to be hesitant because you're saying the heart is still beating, so you're talking about a mechanical factor, and I'm talking about what's read on the monitor. So I'm not inside the, you know, I'm not doing a autopsy or opening up and seeing what's going on. I'm just looking at well, the only thing we can do, an external monitor, which has error. It's not
Right.
100%.
right.
You know, there's nothing 100%. Mammogram's not 100%. You know, we have tests, but they're not 100%.
Right.
So absolutely that other percentage could account for what we see in this case.
Well, first I want to make sure what your testimony is. The baby's heart can still be beating, but the baby's actually dead. True?
The baby's, no, this is what I'm testifying. The fetal heart rate monitor
Okay.
can still be recording or reporting a fetal heart rate
Right.
because the umbilical cord has not been severed
Yes, ma'am.
and the baby be dead.
Okay.
Okay.
So the baby's heart rate's showing up because even though the baby's dead, because the umbilical cord is still attached to the mother. True?
I've seen that, yes.
Okay. And that's what happened here. True?
It will make sense. If anybody goes in, I think a janitor can look in when they go in intra-op and see a skull that looks like a sponge and say, something's gone on that's more chronic than the more acute.
Okay.
Because we got bony structure soft.
Okay. I think I asked you earlier whether you'd ever attended an autopsy. You said you've never attended an autopsy. True?
Since
As an
residency.
attending. And actually, I went back and read that too, and it was, you actually read it incorrectly. It says
Did I?
encourages.
Right.
Yeah, I did. Yeah, but I thought you made it like it was mandatory.
No. I'm
Okay.
pretty sure
I
I
just
read
went
it.
back and read it afterward.
Encourages.
But that's okay. That just moving right along. Yes, we work on cadavers when we're in medical school.
Uh-huh.
So we do quite a bit with, you know, the dead body.
Right,
That's how
well,
we learn.
Working on
anatomy.
a cadaver in medical school, you're not determining the cause of death. True?
No, not in that situation.
Right.
But when we do pathology and do other clinical rotations, we do explore all those fields in
When-
depth.
Sorry.
No,
You
that's fine.
finished?
In depth.
When were you in medical school?
1993. I'm 48, so whatever. Yeah.
1990.
1993.
Okay,
1991.
1993.
Yeah.
So in 1993, you
That's when I graduated. Yes.
okay? And where'd you go to medical school?
Meharry Medical School.
In Tennessee?
In Nashville, Tennessee.
Okay.
Nashville, right down the street from Vanderbilt.
I was born in Columbia, Tennessee.
Okay.
You know where that is? No.
No.
I'll withdraw the question.
I'm not sure.
Nashville, Tennessee, Meharry, you call it?
Meharry. Meharry.
Okay. And you graduated 93.
Mm-hmm.
Yes.
Yes.
And you went to undergrad where?
Oakwood University,
Okay. Where's that?
Seventh-day Adventist School in Huntsville, Alabama.
Huntsville. Okay. And you graduated from there when?
88.
Okay. So in 93, when you were at Meharry Medical School in Nashville, Tennessee, you used cadavers.
Yes. Yes.
Dead bodies to learn, right?
Yeah.
Now, when you were in medical school, you didn't perform an autopsy to determine a patient's cause of death, true?
No,
Okay,
we just looked at things and read on things.
right.
Yeah.
I mean, it's part of your training, part of
Right,
medical
right.
school, right? And in fact, you've never performed an autopsy, true?
I don't recall.
Do you recall
We
ever?
don't really have to perform it because actually Vanderbilt, their students didn't even use cadavers because they know that you don't have to do hands-on to learn. So they just read it out of books. And actually for pathology, we could read what a dead body would look like and what changes would occur without putting hands on. When they say skull, bony structure softening, greenish fluid coming out that's malodorous, I don't have to go smell it and look at it and feel it before that sinks into me and I digest and learn that principle. I can read it and learn it, so I don't
Sure.
always have to have the practical.
Okay. But my question's a little different. Have you ever performed an autopsy?
Not that I'm aware of, no.
Okay. So you've never performed an autopsy, true?
No.
Okay. Well, that's true. You've never performed an autopsy, true?
That's 3 times you've asked.
True.
Okay.
That doesn't mean I will know what the signs of death are. I think
Okay.
most physicians know that and
Right.
what the pathologist would see because we're still tested on the pathology of medicine. We
Right.
have to get tested on everything before we're a medical
Understand.
doctor.
Right. And and at the same time, you can have a fetal heart rate monitor showing a baby's heart still beating, even though that baby's already dead. True?
Oh yeah, absolutely, because a fetal heart rate monitor is not 100%.
Okay. And back to I think we're at the.
And I just want to add another
Dr.
comment.
Page.
That's why we have invasive testing now too. We have
Okay.
internal
I got a copy.
scalp. Oh, I'm sorry.
That's right.
Internal scalp electrodes because we know the external is not as adequate.
Right. Well, no internal scalp electrodes were placed on Angel Mylan's baby.
They
True?
wouldn't be. She wasn't in labor.
Okay. She was never in labor?
No.
Okay. Well, did the nurses not share with you that she was having contractions?
She wasn't in labor. She was actually 36 weeks, 35 weeks. Contractions don't define labor. You have to
Right.
have a regular contraction period
Okay.
that does not subside with fluids, etc. So contractions by themselves do not define
Okay.
labor.
And it's your testimony Angel Mylan was not in labor.
She was antepartum, according to, yes,
And
everything we know.
is that one of the reasons you did not deliver her baby on May 21st, 2012?
Of course, if she was in labor and HIV positive, I would have gone in to deliver because
Right.
that's a risk for maternal fetal transmission.
But she was not, so you did not. True.
Right.
So we've got the Dr. Page, the obstetric ultrasound report that we were looking
Yeah,
at
that's
that
sorry.
we marked as 10.2, which is Southfield Medical Center 0129, et cetera. And the baby's fetal heart rate of 125 beats per minute. The fetal heart monitor can absolutely show that, and the baby already be dead. True?
True.
Okay. And then it goes on to say they did a biophysical profile. True?
Yes.
And immediately beneath the fetal heart rate, we've got umbilical cord, 3-vessel cord, suboptimal visualization of insertion. True?
Yes.
And what does that mean?
He couldn't see the cord insertion,
Okay.
which doesn't mean
And if you flip on over to the next page, the biophysical profile is 6 out of 10. Right?
yes.
And that, of course, includes an ST, right?
Right.
And that's why it's 10. Let's see. So what that would, well, flipping over to the next page, Southfield Medical Center 0131. This is part of Dr. Page's report, amniotic.
Same thing.
Oh, yeah.
I'm sorry.
Just making sure we got the same.
Okay.
thing.
Amniotic fluid volume is appropriate for the assigned EGA with an AFI of 16.1 centimeters. True? You see that? I'll show you.
Yeah, okay, I see now.
And
So,
the assigned EGA with an AFI of 16.1 centimeters, what is that?
what do you mean?
What is that?
He just calculated in the 4 quadrants of the mommy's belly, the total fluid he saw, and added them together. And it was 16.1. So
Okay.
that's fine. 5 and above is good.
All right.
Even though when it's 5, you get a little worrisome. But,
All right. So, and that's reassuring, right?
yeah.
Okay. Then we've got reassuring fetal movements, tone, and respirations were all observed. True?
Mm-hmm.
Yes?
Yes.
Um,
It said reassuring. Where are you now? I'm sorry.
it's the same place. Begins amniotic fluid.
Reassuring. Okay, now that's a little discrepancy here because we
Okay.
have a biophysical that says no movement, and yet over here we have reassuring fetal movement.
Where do we have no movement?
Right over here on page, I don't have the same page numbers you
Okay.
have. 0130
Yes, ma'am.
has movement,
Right.
and it says,
Did I get,
well, here it is. It's, are you on the right page? Let me see. Yeah, 0 for movement. In the parentheses, 0 points for NST and movement.
Okay.
But on the very next page where you pointed out, it says fetal reassuring movement.
the 0130 is the one.
Yes.
she said.
0130, you have fetal reassuring fetal movement.
Okay. So, well, you agree that a dead baby would not have reassuring fetal movement, true? Or it could have reassuring
Yeah, but of
fetal
course,
movement.
we're dealing with the external ultrasound. Maybe it looked that way to him. I'm not sure. But we see a discrepancy here. One minute he doesn't see movement. We got points taken off. One minute he says not only does he see movement, because you can see movement and it still not be reassuring, but he's calling it reassuring. So we went from one extreme to the other. None to great movement.
Okay.
It's a little awkward.
Well, a fetus can not be moving one moment and moving the next moment, true?
Yeah.
Okay. So according to Dr. Page, there was reassuring fetal movement, true?
Yes, I'm seeing that, but I'm seeing his report of no movement over on this same report. So there's some confusion
Okay.
and there's some error.
It's also possible to have what appears to be reassuring fetal movement in a dead fetus, a dead baby, true?
I don't know, because the baby can move around with agonal movements. I wouldn't call it reassuring if they're dead. But see, we already see there's error here, so I don't want to speculate with error. You have no movement here, and then you have reassuring over here. That's a big problem,
Okay.
especially for the physician when they're reading it. I mean, we don't know what to do, because you don't just have movement, which could be in the gray zone,
Okay.
in between none to reassuring. But he has reassuring.
Right.
That's totally, and actually, to be honest, this end diastolic flow with a growth rate of 33% is very awkward.
Okay. Awkward.
Very awkward,
Okay.
because the Dopplers are to tell growth restriction. And when you have any abnormality in the Doppler, that means the baby's growth restricted. He doesn't even have it recorded that this baby's growth restricted, and he said no diastolic flow. Now, even when you have some,
flow.
but it's abnormal, it should be some growth restriction revealed on this ultrasound. But he has no end diastolic flow, but yet he shows the growth is great. It's normal.
Okay.
There's some awkwardness with this whole report.
All right. And you can have fetal movement in a dead fetus, true?
Diagonal movements, twitch, I have no idea.
You don't know.
I would just say I'm not familiar with that in its entirety. I wouldn't want to comment on that, but because what movements are to the mommy versus movements, real movements, may just be some floating around in this 16 centimeters of fluid, which is quite a lot.
Okay.
So, and that's kind of odd too. At 36 weeks, we have all these problems with this patient, but she has not just normal fluid, but great fluid.
Okay.
None of this picture makes sense.
Okay. And what about it doesn't make sense?
Quite a few things. First of all, just what he put here, which is easy for anyone to see because we're reading the record and it contradicts itself right in the report.
Right.
But then secondly, knowing about the Doppler studies, you cannot have growth, there's no evidence of growth restriction. And we have the most severe Doppler study report result. And
Right.
there's no growth restriction on the
Okay.
report.
All right. Let's see. Tone and respirations were all observed. Can you have?
So how did he find tone?
Well, let me
if we
let me
had no
finish my
movement?
question. Okay. So we've got tone and respirations. Will you be able to observe respirations in a dead fetus?
I'm not sure. Well, Agonal breasts could look like respiration, so
Okay.
you never know. But yeah,
So you can.
you probably observing incorrectly, but you could make that conclusion.
Okay. Same thing for tone. What is tone in this test?
Well, when the baby has a movement of extension and then quick flexion, not
Okay.
even just flexion, it has to be quick return.
Okay.
But here we don't have a baby with movement, but yet we have tone.
Okay. You can also observe what you feel is tone in a dead fetus. True?
That's what I have no idea. It just looks kind of odd.
Okay.
Yeah.
So you don't know whether you can observe tone in
You-
a dead fetus?
You know how we get rigor mortis after a while, with
Yes,
the
ma'am.
baby still connected to the umbilical, through the umbilical vein to mommy. Maybe you could still get that. Who knows? Maybe that's why he saw it incorrectly.
That would enable you to observe tone in a dead fetus.
I'd be more persuaded to say no. You
Okay.
couldn't see that much tone in the dead fetus.
Okay. Antenatal score of 6 out of 10. If you flip on over to the next page, 0132,
Here you go.
we've got an antepartum course. Up top appears to be uncomplicated. Do you see that? We're on the same page.
She's
Yes.
got it.
Yeah.
Yeah. And he said antepartum course uncomplicated?
I'm sorry?
Never mind.
You disagree with that?
Doesn't look like he knows the patient.
Okay. All
I
right.
mean,
Doesn't look like
let
he
me
knows
back
whether
up.
the
Let me
pa-
back up
whether
on
the
this.
fetus is dead or alive either.
No,
True?
let me back up. He just had his partner 3 weeks ago
Uh-huh.
assess this patient in the hospital and see that she's HIV positive, she's diabetic.
Right.
They're obviously trying to rule out preeclampsia because they did PIH labs. We didn't discuss that, but that was above where we are here.
Do you think the Angel Mullins baby was preeclamptic?
Well, let me finish my train of thought real quickly. He
Okay.
knew that this was a complicated case, and he says her antepartum course is uncomplicated. How much of this report will we even consider in treating the patient?
Mm-hmm. Okay.
I mean, it's got a lot of, it's not just little errors, because I know I talked to you earlier about the human factor, but we've got a lot of errors here, and significant errors when a baby's life, you just said we play the interdependence. We rely on the perinatologist, I'm the
Yes, ma'am.
obstetrician, that's all I am. I rely on the hospital, I rely on the nurses. The hospital and the nurses look like we all did the best we could with this report. It's kind of crazy.
Okay.
Okay?
Dr. Page's
It doesn't-
report.
It does not make sense, okay?
Okay. All right.
So it doesn't, you really, it's kind of dangerous to make a comment and you're not sure. It would have been better for him to say her antepartum course is unknown to him.
Okay.
But it wasn't, because he had his partner in the hospital document on the South Fulton Medical Center records. This lady's had 2 stillbirths. That alone is high risk. Number 2, diabetes. Number 3, HIV positive and not compliant. And Dr. Page is familiar with the Grady system, so I'm sure he could call Dr. Gary, 2 colleague perinatologists, with a phone call. More than what we could do, and say, hey, what's going on with Angel Milan, and get the synopsis and the whole summary on this patient.
Okay.
The noncompliance, the decline in antiretroviral therapy or not taking it. So how much does she care about her fetus not even taking antiretroviral therapy?
You're saying Angel Mama didn't care about her fetus?
I'm asking, how much could she care about her fetus without taking the things that would help her baby?
Yes, ma'am. Would you read my question back, please?
No, I'm not saying that. That answered your question. I'm just saying I would be suspicious to investigate that. Because if you care about something, you do everything in your efforts to make sure that that baby's okay. But you show noncompliance, not just with visits, but with medication. And we're not talking about just diabetes and hypertension, which are significant enough, but we're talking about HIV.
Okay. Would you read back my question, please?
You're saying Angel Milan didn't care about her fetus?
It looks that way.
Okay. Flipping on over to page 132, South Fulton Medical Center. Looks like
Use those numbers.
I think under the she admits, and I think it's kind of funny the way this is slid to the left, but you see what I'm talking about on that?
Yes.
It looks like she admits, and I think there he's talking about Angel Mullen, right?
Yeah.
It says decreased fetal activity over the past day. True.
Yes.
Nausea and diarrhea, right?
Mm-hmm.
Yes.
Yes.
Started antiretroviral regimen in January 2012.
Yes.
So Dr. Page, according to this, knew that she was HIV positive, true?
Yes, I hope he did. So,
Okay.
which goes hand in hand with the statement and how it's not relating to her whole course. But I just want to comment on something else.
Sure.
Nausea, diarrhea, started antiretroviral January 2012. So he knows that. We didn't even start seeing. He didn't even start seeing this patient in April. So he says January. So where was he getting that from? Because wherever he got that record from, he should have known this patient was non-compliant, that she was not on antiretroviral therapy. Because he sat up here and put this in his note, January 2012. So it looks like he did make that call to Dr. Gary.
Yes, ma'am.
But yet he decided to filter in what information he wanted. I'm trying to understand. You
So
think Dr. Gary would have told him everything that was going on? He's saying nausea, vomiting, started antiretroviral therapy January 2012.
Yes, ma'am.
Where did he get that? Did you see any January records?
So are you faulting Dr. Page
No,
for
I'm
his
asking,
report?
where did he get it?
Well, I'm not here to answer your questions.
No,
So, but you fault Dr. Page?
I'm not faulting him. I'm just
Okay.
wondering where he is getting his information, because it's crucial, because we're depending on him in terms of implementing the outcome that's best for this baby and her mother.
Mm-hmm. Okay.
So are you just throwing information on a report that sounds good, or where are you getting it from?
Are you suggesting that Dr. Page was just throwing information on his report?
I'm just trying to I'm concerned like any other practitioner, because I have to realize if this report is credible or not.
Okay. Do you think the report is like Angel Mullen, less than credible?
Object to
I didn't
form.
understand that.
I think you suggested earlier that you question Angel Mullen's credibility. True?
I think you used those terms. Those were your words. Object to the form.
You may answer.
We just showed that she's told two different pieces of information to two different providers. So whatever you want to conclude from that.
I think.
She's given different information to two different providers. That's the fact.
Okay. I believe that there were things that caused you to question Angel Mullen's credibility. True?
If I see two
testified-
different pieces of information to do two different providers, I think it would be wise for me to wonder about credibility,
Okay.
because information's different with two different providers, and you gave the history.
Right. So that.
That would conclude that something's wrong, because they both can't be right.
Right. And it causes you to question Angel Mullen's credibility. True?
If I wanted to further deduce things, yes.
Okay. Now, you also question the credibility of Dr. Page's report. True?
And that's obvious, because it conflicts itself within the report.
So that's yes, right?
Yes.
Okay.
1 minute there's no movement. 1 minute not only is there movement, it's reassuring.
All right. There was something else that came up while we were talking, and it was preeclampsia, and I don't want to interrupt your train of thought, but did Angel Mullen's baby suffer from preeclampsia in your view?
There's a possibility.
Okay.
There's a possibility.
Do you remember whether she had protein in her urine?
I don't, well, seeing that she didn't come in the day that I sent her to get all those studies done, and here's another example of her non-compliance,
Right.
then we can only make assessments upon your cooperation with our efforts to get the information to, but then when you study the literature, you can have preeclampsia without proteinuria. That's a
Got
later
it.
sign.
Okay.
So, yes.
That was my next question.
Mhm.
You know what the signs and symptoms of preeclampsia are?
Usually you see blood pressure, but it's not on one occasion. It's usually on 2 different office visits, and it's usually 140 over 90 or above.
All right.
The proteinuria from a urine dipstick can definitely give us that, or a 24-hour urine of 300 milligrams or above, or over 24 hours.
Would a dipstick be reliable in a situation like that?
A dipstick is definitely quoted as reliable because
Okay.
you dip it, and if that's all you have, you err on the side of caution instead of, whatever else. But just because a dipstick says negative doesn't mean anything. That's why we have a 24-hour urine,
Right.
which she wasn't able to get for because of the non-compliance.
And you requested one.
She never went in to request one.
Okay.
We saw she was sent from the office on the 23rd, and she never went to the hospital. And I don't see that Dr. Page and them did that as well either, seeing that they saw her on the 27th in the hospital, and their routine standard of care is to follow up with patients outside. So to try to defend him, I would assume that he did ask her to come in and get a 24-hour urine, and once again, she was non-compliant.
Okay. You
Otherwise, he didn't do what he was supposed to do as standard of care, since he was now acting in this patient's best interest.
Dr. Page. Yeah.
He and his group that saw her on the 27th. Sure, they asked her to come in the office, like they do everybody.
Okay.
24-hour urine, because you saw she had elevated liver function test. You see
Right.
that on the 27th? She had elevated, okay.
Okay.
So you wouldn't just randomly have elevated liver function test.
Okay. So we were talking, the LFTs don't have anything to do with preeclampsia, true?
That's not true.
Okay.
It can progress to eclampsia or the HELP syndrome, which is hemolysis, elevated liver enzymes, and low platelets.
Okay.
That's the acronym.
So what other signs and symptoms are there of preeclampsia? You mentioned
Well-
the proteinuria,
The headache, but it's nonspecific,
right?
You can have the blurry vision and scotomata. That's when they see the spots. But that can be from dehydration, so that's not specific either. You have to have a lot of these factors together to try to make a prudent decision and say, this is preeclampsia. Definitely with a 24-hour urine, we could have detected
Right.
it. But she didn't. It sounds like the noncompliance was a major, major issue that she obviously did not care about.
Well, what about swelling?
Swelling happens in pregnancy, so that's not a big thing. They used to tell us the generalized edema was significant, but now they're not going with any of that as
Okay.
much, just
Right.
the other parameters.
So you never diagnosed Angel Mama with preeclampsia, true?
We tried to. We sent her over to the hospital on April 23rd with a
Uh-huh.
blood pressure of 140/80.
Right.
Just being super sensitive.
Yes,
because,
ma'am.
she hadn't had much follow-up. So I wasn't sure if she would have had another blood pressure that was elevated had she met her prenatal care appointments
Right.
with Grady and with, everybody else that had anything to do with her prenatal care.
Right.
So we sent her to the hospital where she would have stayed in for observation, getting serial blood pressures, possibly getting a 24-hour urine protein, and she decided and opted not to.
Okay. Did you do a dipstick on
Um,
the 23rd?
I don't know, it was back then. Let me look and see. It says trace.
What's that?
Trace.
Trace of protein?
Mhm.
Okay. What do you mean by trace?
Well, like I said before, that's inconclusive when you can send them to the hospital and get a 24-hour because they could be negative, and that
Right.
wouldn't mean anything as well.
Right.
That's why there's a 24-hour urine, because they realize that protein spills randomly.
Got it.
I can't just say, oh, it's negative now, and there's no concern.
Got it. All right, so back to Dr. Page's report, SFMC 0132. I think we talked about Angel Mama admitting decreased fetal activity over the past day, nausea, diarrhea, started antiretroviral regimen January 2012. Also shared with Dr. Page, according to his note, diabetes, monitoring her values, and reports elevated values. True.
Yes, I see that. I see
Okay.
something else disturbing, too.
Okay, what's that?
Right in his report, he has her OB history was significant for 2 VTOPs. Do you understand what that is? That's
is a
voluntary obstruction of her pregnancy. She had abortions. One minute she tells Dr. Gary they were miscarriages.
Okay.
Then she tells Dr. Norman, I guess that was, his partner, in that April 27th note at South Fulton, that they were stillbirths.
Mhm.
Now, Dr. Page said they weren't miscarriages, they weren't stillbirths. She just aborted them.
So she told 3 different stories in your
I have no, this is all we can go on, this documentation, because you're going on it and I'm going on it.
Okay.
So we have 3 different histories from this historian. I
All right.
think that is extremely concerning.
Which makes Angel Mullen even less
Extremely
credible.
concerning.
Which makes Angel Mullen even less credible. True?
If somebody told you 3 things and there's one answer, I think I would feel that I can't trust the person.
Okay. So you didn't feel like Angel Mullen is trustworthy. True?
Is that past tense or
Past
present tense?
tense, yeah, I didn't know all this past tense. But right now, looking at the notes, it looks like she's got a issue with that.
Issue with what? Telling the
Credibility.
truth?
Yeah,
Got it.
being forthright.
Okay. Insulin regimen. Reports overall adequate control with elevated values. True.
Okay, she reports it. I don't understand that at all. What does that mean?
Okay. She reports elevated LFTs last month. We're talking about liver function tests, right?
No, that's a separate note. Now we're down to the reports overall adequate control with elevated values. Is she talking about her diabetes, glucose? Is she talking about her liver function tests? Is she talking about her blood pressure? And how would you even write that? Why would that be significant? That's something the patient reported, that she's had overall adequate control with elevated values.
Okay.
That shouldn't even be there. This is his assessment that we need, not hers.
Okay.
She's not a doctor.
How many patients had you sent to Dr. Page in May of 2012?
I don't remember that.
Hundreds?
Not hundreds. I don't remember.
More or less than 500.
I mean, there was his partner, Dr. Boots Taylor, that we used too, and they split up for whatever reasons.
Okay.
So we actually patronized him as well.
Okay. But you still sent patients to Dr. Page, right?
No.
You didn't send any patients to Dr.
You said,
Page?
do I still send?
Did you?
Yeah. Yeah.
Okay.
Yeah. I didn't know any of, you know.
You wouldn't send a patient to a physician you thought would endanger a patient, would you?
Yeah, you know, you don't find out things till things are done. That may be something you need to redirect. Like right now, looking at these reports, I probably would try to find another perinatology group.
Okay. But
Yeah.
didn't you look at this report when you were caring for Angel Mullen?
Yes, but I didn't have all these things that we have in this deposition to show that there's some issues with her credibility. The October note from Grady, you know, hindsight's always 20/20. You know, we're dealing with something, you know, on the day of, and now we're sitting back after 3 years. What has it been? 2 years, 2.5 years of evaluating these notes. Then it's kind of getting more clear.
But
to
isn't
see.
isn't it important that it be more clear when you can still save the baby than it is 2.5 years
Exactly.
later?
So, looking at his record, wouldn't have done anything. If I thought that he wasn't credible, I wouldn't have sent her in at all, which would have been more confusing, because then we would have had a dead baby, and then there would have been some, you know.
Well, the baby's already dead when Dr. Page saw her,
Right.
true?
But I'm saying your point that you were trying to make with thinking that his note was incredible then wouldn't have had anything to do, because this baby was still sent in with whatever urgency we thought, and we were trying to do the best things, only to find out it had been, you know, expired for at least over 24 hours or more.
All right, Dr. Page, if you flip on over to SFMC 0135, do you see that? Part of Dr. Page's report regarding Angel Mullen.
Oh.
It's 135, Jim.
135. You see where it says impressions increased fetal risks related to the 610 BPP score in the setting of decreased fetal movement and abnormal Dopplers. True?
Yes.
And that's a report you had on May
Yes,
21st?
that's why we sent her in.
Okay. The risk of conservative management with continuation of this pregnancy is greater than the risk for delivery. True? Number 7. Yes?
Yes.
And due to her abnormal Doppler values, would not anticipate her tolerating a vaginal delivery. True?
True.
And it reads here, Dr. Page's recommendations to you on May 21st, 2012 were admit for delivery. True?
Yes, true.
And in fact, he sent Angel Mullen directly from his office to Southfield Medical Center
Exactly.
to have the baby delivered. True?
Right.
Via C-section. True?
Right.
By you. True?
Right. Well, by whoever was on call.
Okay. Well, you were her physician. True?
Yeah, but I actually took care of her, and I wasn't even on call that night. But that's, yeah.
Okay. Well, it was Dr. McDonald said she was not on call, right?
We won't get into that.
Okay. She will need intrapartum AZT therapy. True.
Right.
AZT therapy is to help ensure that the baby doesn't contract HIV. True.
Yes.
And continuous fetal monitoring. True.
Yes.
So he recommended continuous fetal monitoring.
Continuous fetal monitoring.
Okay. He also recommended a cesarean delivery,
Yep.
which is what you plan to do. True. Yes.
Yes.
He also recommended that the patient advised to follow NPO. True. And NPO means nothing per oral. Right.
Yep.
That
Per
mean-
us.
Nothing
Per us.
Oh, per what?
OS.
What is OS? Never heard
Nothing
that.
by her mouth.
Right, and her mouth is OS.
Yes, nothing by
What is, and that's an abbreviation for what?
I'm not sure.
Okay, so nothing per NPO, which is
Yeah.
no food or
No
liquid
food.
coming in
Yes,
her
nothing
mouth.
in her mouth.
Please monitor glucose by finger stick, Q2 hours with sliding scale insulin coverage. Right? Yes.
Yes.
Follow newborn HIV protocols. True.
Yes.
Please document PIH labs due to her history of elevated LFTs. Dr. Whyte was notified and patient was directed to Southfield Medical Center labor and delivery for delivery. True?
True.
Now, she was admitted for delivery on May 21st. True?
Yes, true.
And that was that afternoon, early in the day, right?
Let me just object, that's compound. She was admitted on May 21st. I'm not certain she was admitted for
Go ahead,
delivery
you
on
may
May
answer.
21st.
Yeah.
I'm sorry?
Oh, we're gonna get to that. I'm just waiting for him to finish.
I've forgotten the question.
Okay, you were trying to figure out if it was morning or afternoon. It was afternoon, early
Yeah,
afternoon. It wasn't
right.
morning at all. Okay.
So what, I think my question was, mind telling me what my question was?
She was admitted for delivery on May 21st, true? Answer yes.
Okay, yeah. Thank you.
And I object, it's compound.
Angel Mullen was admitted for delivery early afternoon on May 21st, 2012. True?
Object to the form, it's compound.
She was admitted, yeah, for her AZT therapy and for delivery at some point.
Thank you. And you did not continue the fetal monitoring, true?
No.
Okay. And you did not perform a cesarean delivery on May 21st, 2012, true?
No.
Well, it's true, you didn't perform you didn't do the cesarean delivery on May 21st, 2012.
Right.
Okay. And you did not continue the fetal monitoring, true?
True.
Okay. You also didn't put Angel Mullen on NPO. In fact, you had the nurses at Southfield Medical Center give her both food and liquid by her mouth, true?
I don't recall that, but that did, I guess that did get ordered. It wasn't implemented though.
It's your testimony that they didn't feed Angel anything on May 21st,
I
2012?
think that she had the crisis, and I can rewind a bit so we can see why all this looks so non-compliant with Dr. Page's.
Just let him
recommendations.
Just answer the questions he asked.
Okay.
It's okay.
Go ahead.
Unhand that woman, Paul. Go ahead.
You go ahead.
I don't remember. I think you were answering the question. You were talking about
whether she
rewinding
ate
to
or
explain
not.
your answer.
What's your question again?
You were explaining why this, it appears that you were non-compliant with Dr. Page's orders or recommendations
Okay.
right?
Well, the question,
What's
Well,
the
let me-
question was whether or not she ordered the patient food and drink in contravention of an NPO order. That was the question.
Right. Oh, you want me, okay.
Well, whenever he finishes, whatever.
I'm done.
Okay.
Okay.
So that happened at, like, looks like 10, is that 10 o'clock? Yeah.
Okay,
10 o'clock at night.
you're looking at Southfield Medical Center, 0044, which is what, your physician's
I guess
orders?
what you were referring to about the continuous monitoring being discontinued, the food, diet ordered, et cetera. Okay.
Okay, so you were explaining,
Okay, so she was admitted earlier that day, and we had one status. And this is what Dr. Page recommended for that status, because we know that obstetrics is dynamic. So things change moment by moment, minute by minute, hour by hour. Uh-oh. So when she got there, the NST in his office was recorded as non-reactive or, not reassuring. But when she got to the hospital, it became a little bit more reassuring, and the nurses were trying to get her AZT, which he also recommended. But the AZT took us actually over 2 or 3 hours to come up. I remember explicitly making a call to him and saying, do you think this patient needs to be delivered like now? He said, well, did the AZT come? I said, well, no, but we can just do whatever you feel is more recommendable. And he said, no, we need to wait for the AZT. So the AZT didn't start going in till later that evening.
when did the AZT start going in?
Later that evening. And
What time?
I have no idea.
Okay.
I think she can find it in the
It
chart.
was sometime after admission, but so while we were waiting on that, I knew that Dr. McDonough, who was actually the physician on call, some physicians don't like to deal with, HIV positive, so I said, I'll cover her.
Okay.
So I just told the nurses to report to me.
I'm showing her.
So it didn't start till 6 that evening. It says 3 hours, 3 hours after she admitted, 3 or 4 hours after admission.
SFMC QS 0060 1810 is the loading dose of AZT.
Yeah, so that ain't going.
What record were you referring to? SFMC QS, which is the
I'm sorry.
electronic
Yeah,
record.
0060.
60. Okay.
Okay. So it started like at 1610?
18.
1810, I'm sorry. 1810. So anyway, just for relevant, I was trying to make the point that everything was kind of changing, because
Yes, ma'am.
he was under the impression that she would have gotten that, shortly after admission. And then, of course, the nurses were, looking at the status, and the fetal heart rate status looked fine to wait for the AZT.
Okay.
So the AZT was waited on, and when it came up, they started administering it. But because of her body habitus, I don't remember how big she was, but I know she was a little bigger. I know her body mass index in the records was like anywhere from 42 to 46. But she was, it was difficult to keep the monitor on, and we weren't in labor. I think everybody is confused about the recommendations, the standard of care, intrapartum versus antepartum. This was not an intrapartum case. She wasn't in labor. And even with intrapartum, you can do doptones every 15 minutes in labor, but this is antepartum. Antepartum means that, if there's any reason that the baby is not able to stay on the monitor, because, what I was reported, it was moving, very vigorously, or moving around. They couldn't get it for whatever reason. They were really more so leaning toward her body habitus. I said, well, she had a biophysical 6 out of 10. Her NST was reportedly reassuring, so that's 8 out of 10. I said, we can wait, or even if it's not 8 out of 10, because we have her there in the hospital, we can repeat the 6 out of 10 in 24 hours, which we didn't do, because we were able to deliver her much less than 24 hours from the time of the report. But anyway, so that night when the food was ordered, I'm not sure about that. I can't recall, because normally I'm not a doctor to feed, even when they can eat. I'm like real cautious. But with the measures that we were able to use to assess the fetus, it didn't look like that was ominous. Dr. Page was reporting something in the morning, because he called me in the morning, but the patient showed up there, early afternoon, whatever. I think it was 3. What time did she come in? Yeah.
Okay.
Well, when she came in, we didn't feed her. We wanted to see what was going on. And then several hours later, baby still doesn't look ominous. So maybe that's where the nurse got that. There may have been some confusion, but I don't recall ordering it. But I wouldn't have objected to it, looking at the status that we saw at the time. It was not ominous,
Right.
All
right. So when you spoke with the nurses after Angel Mallon was admitted to Southfield Medical Center, they said the fetal heart rate looked fine?
Mm-hmm.
Yes?
Yes.
And how can the fetal heart rate look fine when the baby's already dead?
Oh, okay, we just reviewed that, but just to reiterate.
Yes, ma'am.
We did stress that the external fetal monitor is not 100% accurate. That's why
Okay.
we have made updates with internal monitoring, and we know
Okay.
that's not 100%.
Okay.
Now we just have the external.
Right.
So realizing that the umbilical cord hadn't been severed, I told you there were cases before that I've seen
Yes, ma'am.
fetuses, once we open up, that are dead.
Okay.
And we go back to their strip, and we still saw a reported fetal heart rate.
Okay.
So that's something that's not explained yet in the literature, but it
Okay.
can happen.
Also, the baby was reported to you to be moving vigorously, true?
Not vigorously, I recant that statement. I just
Okay.
was talking, but it moved me.
Okay. So would you expect a dead fetus to be moving vigorously in the womb?
Okay, like I just said, I recant that statement. I just was trying to get the movement clear in your head, not so much vigorously or less vigorously, just movement was reported to me.
Okay.
I think, and there was some doubt about what the obstacle was
Okay.
with the continuous fetal heart rate monitoring. We didn't know if it was body habitus or the fact that the baby was moving.
Okay. But how was the baby moving if the baby was already dead?
Well, because there was some, like I said, they weren't sure if it was a movement issue or body habitus. There may not have been movement. There may have been not voluntary movement. There may have been movement from the fetus in all this 16 centimeters of fluid that Dr.
Okay.
Page reported.
All right.
Because you're in a
But the nurses
water.
reported to you on May 21st, 2012 that the fetus was moving, true?
They weren't sure. They said it looks like, because that's all we can say with an external, assessment of the baby. They said either the baby's moving a lot or it seems like it's moving a lot.
Okay.
So that's what they assumed.
Okay.
Yeah.
So you wanted to recant the moving vigorously and change that to moving a lot? Is that
No,
right?
not moving a lot. Just there was some form of movement they felt
Okay.
instead of
And
the
other thing, you said there was nothing ominous about, I'm sorry, your lawyer showed you something, Southfield Medical Center QS 00.
63.
Oh, well, the patient was saying she felt movement,
Uh-huh.
which also goes back to, the credibility issues, because, she admitted that she didn't feel
So
any
you think she
movement
was
after.
lying when she said she felt the baby moving?
Okay. I can
Answer
say what
that
I was.
question first, and then you can explain your
I'm
answer.
not really sure, but if you
Okay.
get two different pieces of information, you can only come to one conclusion, that the patient is not forthright. So I'll just say
Okay.
it that way.
All right.
Yeah, because after the C-section, she told me she hadn't felt the baby moving for 3 days, and here she's
Okay.
telling the nurse she's feeling movement.
Okay. And you're referring to SFMC QS 0063. RN at bedside, US, that's ultrasound adjusted. Annotation, patient states she feels fetal movement. Fetal movement is also heard via ultrasound, true?
Not heard. That was an error. We didn't have an audible ultrasound. We had a one that's visual. We could just see on a monitor.
So what did somebody put heard in there?
Error.
So that's a hospital error, Southfield Medical Center?
Heard, also
Yeah.
heard. Well, no, you know what? I can't comment on that because they do have audio by the bed.
Yeah.
So I didn't hear it. I
Right.
came in and did the ultrasound, so they probably did hear it by,
Now, you didn't do the ultrasound until the next day.
yeah, when I came
Right,
in.
right,
When I
right.
came in, yeah. There
But
was
this
no
is-
indication to do one sooner.
According to the record that your lawyer showed you. SFMC QS0063, thank you. RN at bedside, true.
Yes.
And this is at 20:09, which is a little after 8 o'clock that evening, right? RN at bedside, ultrasound adjusted, annotation, patient states she feels fetal movement, true.
I don't know that. She told the RN. I wasn't there. So
Well, but
I'm
you see
looking
it
at
here,
true.
right?
Oh, yeah, I see
Okay.
that. I see
And
it.
You expect to have accurate medical records, right?
Right, right.
Okay.
Right.
And then it reads, fetal movement is also heard via
Right.
ultrasound.
And
true?
I thought that was my note you were reading. You're saying now RN at bedside. So
Yes, ma'am.
that makes more sense because they do
Okay.
have the audible, you know.
So
fetal
according to the Angel Mullen and the nurse at Southwold Medical Center, Angel Mullen felt the baby moving around, and the nurse could also hear the fetal movement on the ultrasound, true?
I guess what she thought was fetal movement. Now
Okay.
with hindsight, we know it was just probably the fetus moving around involuntarily in the 16 centimeter fluid
Okay.
from Dr. Page's report.
Got it. So how does a dead baby move involuntarily?
Because fluid you move in usually sometimes. I mean, I have no idea. The cord is attached. It's not
Okay.
just free
All right.
flowing.
Got it.
And there could be agonal movements. We saw that, you know.
Which could also explain the tone that Dr. Page saw.
No, because tone isn't movement. They're two different things. The tone is extension and flexion. Movements are just random, what they're stated as movements.
Well,
Tone is different.
well, I mean, you don't indicate tone by movement of limbs?
No, I think
Okay.
you just read the biophysical and it stated in detail what it is. Tone is extension and flexion, and movement is just the random movements of the baby.
I thought there was a differentiation based on torso and extremities, but I'm just wrong
No,
about
it's
that, I
not,
guess.
because
Okay.
actually you can open and close the hand
Okay.
and that be flexion and extension for tone.
Let's see. Sorry. Do you agree that Dr. Page's note at SFMC 0131, reassuring fetal movement, tone, and respirations were all observed, is inconsistent with a dead baby, true?
But then on this page before that, on the same report, he has 0, no movement.
Yes,
So I
ma'am.
don't know what to make of that because those are two different, extremely different things.
Okay,
There's no movement and then there's great movement.
okay. So you don't know how
Well, we
to-
talked about that earlier, so I can't comment on something that
Yeah, but
has that kind of.
My question was really just what's written here. Quote, reassuring fetal movement, tone, and respirations were all observed, close quote, is not consistent with a dead fetus, true?
And I can't answer that because
Okay.
that's not the total report. The report says no movement, and then it says reassuring movement.
Okay.
So there's a problem.
Just going through my notes. I think we've covered this. All right. I would like for you to have a look at Southwold Medical Center 0137. We're going to go through these
What is that, Jim, so I can find it?
That's a labor and delivery flow sheet.
Okay.
There's a- I'm going to go ahead and mark this. We're going to 137 to this is the beginning of the labor and delivery flow sheet for Angel Mallon, true? We're going to mark the labor and delivery flow sheets, which begin at SFMC 0137, make it 10.5, and goes through uh, 159 as 10.5, right?
Okay.
Is that all right?
Yes.
Okay. If you look at, according to the flow sheet, Angel Mallon was there by about 3 o'clock in the afternoon. Is that right? 3:10. Do you have
Yes.
Have you looked at the admit record to see when she was admitted? We don't. Southfield Medical Center 0001, which is the admit date and time, has an admit date of May 21st, 2012 at 15:20, which is 3:20 in the afternoon. True? Yes?
Yes.
You agree with that?
Looks
you-
like it.
Okay. And then at 16:30, the fetal heart rate baseline was 130 with moderate variability, true?
Yes, I see that.
And 10 by 10 accelerations. We'll go through the monitoring strips.
Okay.
I'm the ones for this submission, please.
Actually, I'm gonna take a short break. And just say break, man.
No,
You want to go ahead and grab something to eat?
I got the strips. What's up to you?
Well, I need to grab something.
There's a snack.
We are off the record at 1:51 p.m.
I think the little restaurant.